Là, pour papa. Non, parce qu'il faudra l'intuber et la mettre dans la salle de réveil, non?
Got an entry wound here, an exit wound here that's taken off his ear. The question is how much brain from it. So we'll look at it.
No, there has to be sort of some local collection of blood in his brain for us to be able to help him. It's about all we can do here. And the chances of that being the case are quite slight, and his coma's getting deeper.
Adrenaline. The armed men came to the house at midnight and they said, give us your money. So then they shot the father at pretty much point blank range in the head.
Papa. Abari. Abari, papa.
So two in the right place.
Well done, man. Might have hit the brain, he's not sure. It would be nice to have a CT scan.
Il faut être sûr, lorsque j'opère, il faut être sûr, il faut décider. Je ne sais pas que il a l'œdème à l'intérieur, sinon calme-toi. On complète le trou et on draine. C'est là, c'est le brain, c'est là. La tension, c'est combien?
Pas beaucoup. 4.
Regarde un peu si pénètre.
Parce que ça, c'est trop dangereux.
The usual drill bits are used for drilling into people's brains are sort of rounded, so you can't like just sort of fall through it into the brain. No, that's what we do.
C'est jamais arrivé, je pense. In fact, it's not the best of drill bits to use for that.
Oui, mettez un plus grand. Oui. C'est l'unique chose qu'on peut essayer de faire. Il commence déjà un petit peu à drainer. Hein.
Ah ouais? Ça coule?
Ça coule, regarde. C'est
frais?
S'améliorer?
Ouais, s'améliorer.
Drilling a hole in his head seems to have helped him a bit. The question is how much damage there is to the brain, and that we won't really know. No, we just have to wait and see how he wakes up and what he's like. And work without oxygen in the theatre again, like yesterday. Let's go away. Okay. Let's go back towards the hospital. Okay.
Merci alors. Okay.
Salut.
Every war situation, you see the civilians that are all terrified, and you see some people who enjoy killing people.
Hundreds of civilians have been killed and injured in the small West African nation of Liberia. Dr Chris Brasher is an Australian doctor with Médecins Sans Frontières who is in Monrovia. I spoke to him a short time ago.
In 2003, I was working with MSF in Monrovia.
People being injured are civilian. People ask me all the time, what is the international community doing about the situation?
That time was sort of a turning point for me. People being carted around on wheelbarrows with big holes in them, blood all over the streets, no water, no electricity. no food. Pretty apocalyptic, really. Buildings getting peppered with stray bullets and occasionally with mortars, and people just getting randomly killed the whole time, civilians. Going to Monrovia in 2003, that was kind of what decided that I didn't have the stomach for it anymore. So that was the beginning of me getting out of MSF.
Intubation, mais finalement tu...
Quelqu'un qui va venir près de nous.
Arrogant? Why? Because people in MSF can actually choose what they do.
You don't come to like Kana and ask people, okay, so what do you want?
Let's have a talking group, and we'll decide what you want. What happens is that we come, we turn up here and we just say like, this is what we do, and we offer that.
Yes.
No, like touchy-feely, not like kind of touchy-feely, politically correct, politically correct, what you want.
We are.
No, it's none of that.
If I, today, after what we did today, if I like met some guy from UNICEF who was saying about they had 7 meetings in the last 24 hours about all the different sort of theoretical programs that might happen in the next like 3 years. You're like, fuck off, basically. You know, that's basically how it goes. You're just like, fuck off, you know. And so you're an asshole, an arrogant asshole. Like,
aller voir de l'autre côté.
Par là? C'est bon, ok.
On peut aller voir de l'autre côté.
Par là? Ok. Ouais. J'ai rien compris, hein? Qu'est-ce qu'il dit? Il dit quoi? Fumer. Ah, il faut que j'arrête. Oui. Asante. Sorry, I shouldn't smoke. Asante san.
Situations where people are less wealthy are often more human than situations where people are very wealthy. And it kind of fits in that going to do medicine with people that are actually trying to help each other is in some ways more rewarding than doing medicine in a country where people don't give a shit about each other.
Our family was in the bush. Some military guys came and then they started shooting.
Apparently 5 people died. No girl was shot down. Quelle information?
Sinon, le petit bassin. Attends. Oui, j'avais déjà préparé. Et si tu peux me donner des décisions. Regarde, tu vas voir la profondeur de la plaie.
So it just needs to be cleaned.
Nous avons terminé. Après, la plaie. Tu connais?
Her arm will work. Doesn't seem to have hit any blood vessels or nerves. So she's lucky in terms of her injury. Not so lucky in terms of her family.
Il faut lui dire qu'il faut dormir, qu'elle est bien.
Sana njoo utapona. Unasikia? Mama njoo yuko hapa. Huyu. Sasa nyamaza. Nyamaza basi.
Raconte tout ce qu'elle a vécu. C'est ça qui me dit les histoires qui sont passées là. Elle est en train de raconter tout.
Nyamaza, utulizana. Sinzia kwanza. Sinzia. Tena waje kulie. Mungu anatoka wadogo wadogo kuwea vitu mzia. Hauko na wewe mama. Nyamaza mama.
Now she's remembering everything, as I told you. It is so traumatic. It is just not the pain. Now it is the sorrow. Tu vas bien? Ça va.
Basically all the emergency operations that we did this week, all those people would have died without surgery. So those war-wounded patients would be dead. The women who had cesareans, they'd be dead. So would Dada, would have died of infection. And similarly, in the wards, all the people that got good treatment for malaria, all the malnourished people in the therapeutic feeding centre, they would have all died. Yeah, no, they're good results. Good results.
Emporter l'embout. Il faut emporter l'embout, s'il te plaît. Prends le ballon bleu. Le blue balloon.
Stethoscope. Quelqu'un peut rester avec la malade sous anesthésie, s'il vous plaît? Quelqu'un peut faire On va faire ça pendant 2-3 minutes, on verra s'il y a un flou, s'il n'y en a pas, je suis à Canara. Oui, là.
Basically, he's not breathing. We can't keep ventilating by hand forever. So we'll give him, well, it'll be an hour in total of resuscitation. If that doesn't work, then we'll stop. It's not really nice combining futile resuscitation and patients coming into theatre and other ones waking up from anaesthesia, but we don't really have much choice, really. I've got to have breakfast.
Habari. Comment ça s'appelle? Moussa. Moussa? Habari. Ah, Missouri. I said, how's it going? He said, fine. He's actually breathing a bit. Hopefully the oxygen will keep up the oxygen level in his blood and I feel he might survive, which would be a minor miracle.
Just hang in there. Most of the missions that I've done have been in places where a lot of people you couldn't help, and you have to get used to that. You know, you can't expect to turn up in some country where there's a lot of problems and be able to address the needs of the majority of people. And that's why, in some ways, the limit that MSF gives, MSF makes sort of decisions about what the priorities are, and in some ways that's kind of reassuring. But it's really hard to swallow the first time you go out. The guy that we were resuscitating died.
Did he?
Yeah. He was breathing a bit better, and we just put an oxygen mask on him, and then he basically had another arrest and died. He lived for a lot longer than I expected. And made life very difficult not having any oxygen for the anesthesia for the whole day.
He's a chronically sick patient. He's been sick all his life.
Yeah.
Bon, allez, tchac, tchac, to the hospital.
When we decide to end the mission, we leave the people we've come to help in the worst situation.
Donc c'est aussi ça l'humanitaire, c'est qu'il faut faire des choix à des moments, malheureusement.
En caractère spirituel humanitaire, vous pouvez nous aider avec des...
Comme les locaux.
Oui, comme des locaux. Oui, c'est possible.
Mais c'est mieux que pour les locaux, par exemple, eux, ils n'ont pas les...
It has to happen. It's not there forever, and it has to happen one day. It's never easy, but you get more used to the idea. The first time you do it, like the first time you go and work in a mission, you think that you don't think about those kind of things, and you think it's instinctively it's forever, but it can't be.
Once the crisis has abated, what are you actually trying to achieve? Are you trying to fix the normal? So you make choices that are tough choices to make, but you have to make them. You have to say sorry to all these people all the time. We're going to go back to the lot of the average sub-Saharan African existence, which is pretty hard. Normal's not good, but MSF's never been pretentious enough to try and think they were going to have an overall impact on health. It's a drop, tiny, tiny drop in a sea of oceans. So dependent on the context and the general sort of wealth in society and the political stability, that, you know, those are things that you can't fix. Well, I can't fix anyway. Well, it's nice not to see anybody with any guns. Nice. It looks a lot better than it did. It's a lot better than it did. But what's really nice is just seeing all this activity and people going around and they're not scared. It's not how things were during the war, obviously. I'd say that I'm happy about the decision of having worked with MSF, despite the sacrifices and the costs of that decision. Well, I've missed, important things, people dying, people getting married, in my own family and friends. Okay, maybe we can just put the oxygen on. There's some in the air, but sometimes it's just not. it's a real priority for me now, leaving MSF, to re-anchor myself somewhere. And maybe it's just phases in life. I think I wanted to prove myself that the conflicts are real and the people are just normal people. They're just, they're no different to you or I. And that most of the people in the world, have a pretty rough time getting through the day and the week and the month and the year. And I couldn't really be sure, how real that was until I lived with it. And now I have. My attitudes are very different to what they would have been if I had stayed at home. So I won't be exactly the same. I won't have the same priorities as I would have if I hadn't have done it.